Now, Toby, we've just heard about countries there who have started to move early. How does Australia fit into this category?
Look, I'd say Australia is squarely in the first movers category. Looking globally, the report just then listed, maybe 4 or 5 countries that have started to move, but that's about all there is. There's probably less than 10 countries that have actually started to ease off at the moment. And so when you look kind of globally at this cohort of around 200 countries in the world, Australia is definitely one of the first ones that are thinking about rolling back or stepping down those restrictions. I would say a lot of countries are in the same position of starting to talk about it and starting to announce it, but we're still very much at a point where few countries have actually acted on the rollbacks, and so Australia will be one of the first to start moving out of the lockdown.
And given some of these countries that we've heard about have had these restrictions lifted for a month already, a month ahead of us, and they haven't yet seen a sharp rise in cases, is this something we can learn from these countries?
Yeah, definitely. I think the lesson there is that it's a very gradual process. So in the research project that I'm working on and helping lead at Oxford, we're tracking the overall stringency and the strictness of government responses. And, what we saw almost universally around the world was that in mid-March, almost all countries went from very near zero to very near 100. So you had this very rapid ramp up in the strictness of policy responses. On the other side, as we're seeing that strictness curve, if you like, roll back and come down, countries are taking it much more gradually. So, the sorts of restrictions in Denmark that are still in place, in Austria just 2 weeks ago, they started to ease back, but there's still bans on gatherings over 10 people. And I think Australia seems to be taking these lessons to heart and is following a similar approach where on the way into lockdown, it's very strict, it's very hard. And on the way out, it's quite gradual, quite modular, making small changes and seeing what happens.
Well, our health minister says it's looking to South Korea, Japan and Singapore to inform our exit strategy. Which bits of their policies do you think we're looking at here?
So I think that's an interesting set of countries. Singapore at the moment hasn't really started to roll back in a meaningful way. But I think what we can learn from these countries, I will say South Korea has started to roll back about 2 weeks ago. What we can learn from these countries is also a bit about how they went into the lockdown. So I think these countries acted quite quickly with measures around testing, measures around contact tracing, and they also had very rapid responses just from the general public. People stopped going to restaurants, stopped going to large gatherings. They did that voluntarily. And so that meant that for these countries that kind of responded very quickly, we're talking like in early February, they didn't need to go quite as strict. So speed was a bit of the essence on the way in. And, as we're exiting the lockdown, we can perhaps learn some lessons from how having a broad response, a response focused on testing and tracing and on the actual behaviour of individuals, that can mean that we don't need such harsh policy measures in place.
Well, the WHO actually outlines the measures that governments need to have in place before they even consider reducing the restrictions. You've been analysing this data. Have you found that countries have been complying?
Look, I think no country is perfectly in position according to the WHO's checklist. So the WHO outlined these kind of 6 criteria that countries should try to meet before they roll back. In the case of Australia, the very first criteria is to have reduced transmission. And for the last few weeks, Australia was doing really well. But then, in the last week, I think it was in Victoria, there was this recent outbreak at a factory. And so now if you look at the rates of transmission, it's actually climbing in Australia. So I think, the situation changes in every country every day, and countries might meet some criteria one day and then change the next day. So it's a little bit about being adaptive and thinking on your feet and being able and ready to change. I think that these kind of levels of lockdown will help governments do that. I will say on the other measures that the WHO talks about, Australia is doing fairly well. So testing and tracing, there's a lot of testing going on. We've got pretty strong border closures. How long that can go for is another question, how long there's the appetite to keep the borders closed. But certainly the WHO says that countries should have plans in place to manage the risks of imported cases. And I think probably the most important one of the WHO criteria, but the one that's hardest to measure, is about whether communities are really starting to engage and respond to this new normal. Because at the end of the day, that's where transmission happens. And so it's about how people learn to adapt their lives to this new normal rather than just trying to go straight back to business as usual.
Well, let's talk about those border closures. How soon do you think things will return to normal globally and we'll be able to start travelling overseas again?
So globally, I think it will be quite a long time. I mean, there's sort of two parts to the travel. There's, for an Australian, there's whether the Department of Foreign Affairs is willing to let people travel. I think at the moment there's a bit of a procedure to almost get permission to leave the country. That's a question for the Australian government. Maybe that changes in the next few months. But the other side of it is whether other countries are going to let you come in. When we look globally across our tracker of policy responses, most countries in the world right now have border closures. I was just checking up on a few of them this morning. France has said that their borders are likely to stay closed at least until October. So, countries are really getting into this long-term thinking about how they're going to respond to the virus. They're putting in long-term policies. And I think it will be many months, probably into next year, and indeed certainly before we have a global situation that's back to anything close to normal. I think we can expect a lot of quarantines, a lot of screenings, and outright border closures coming on and off, depending on how individual countries are finding their caseload.
We'll check back with you perhaps in a year, Toby, and hopefully things will have changed. Thanks so much for joining us tonight. Really appreciate it.